Let's take a look at pain behaviours when a client complains of knee pain. So we're going to do our 3 tests that we've done previously: an active contraction, active resisted and passive stretch. The difference here is that the client is talking about general knee pain, so it's not as easy as saying, okay, I just need to test the hamstrings, for example. They're talking about anterior knee pain in the example I'm going to go through, so I'm going to start by doing active resisted and stretch of the quads. And then depending on the outcome, that might dictate what more tests I will do. If it's not clear that it's muscular or tendon and actually it's end of range, there's pain and palpation of the knee, then that's when I might want to do further testing in different ranges of motion. And in that case, I'll want to bring that joint through all of its ranges of motion to see if they feel pain at various ends of ranges. And this will help me identify whether it's ligamentous, potentially, or joint capsule, or what's clear is whether or not I need to refer this client onto a physio, osteopath, or GP. So it helps me just work out what's happening and also provides me with more information to document in any referral documentation required. Let's take a look.
We're going to look at injury assessment for a client complaining of anterior knee pain. It's unclear from the descriptions and your subjective assessment whether or not it's an issue in the quadriceps, for example, the patella tendon, the joint itself, or even a ligament or meniscus issue. We're not here to diagnose, but we can do our objective assessment that we learned in today's module to help us understand if it's behaving as if it's muscle strain, tendon strain, sprain of the ligaments, or whether or not it's an issue, a potential issue with the knee joint that we want to refer for diagnosis. So the first thing we do with all injury assessment or any complaint of pain is that visual assessment. I'm looking for redness, puffiness, swelling, maybe dimpling on the knee. And it's also important to compare it to the other knee. Sometimes you might think a knee looks swollen, but actually if you look at the other knee, the good knee, they may look the same. So really good to compare both and look for any visible signs of acute damage or acute injury. Once you've done that visual assessment, we're going to do our 3-step test. Active contraction of the target muscle, in this case the quadriceps, so we suspect if there's muscular involvement, it's anterior, it may be quadriceps. We're then going to do active resisted contraction, and then we're going to stretch the quadriceps themselves. So first thing I'm going to do is remove the pillow. My client's in supine. I could do this testing in prone, but given I've done my visual assessment, I'm now going to test it in supine. So first thing I'm going to do is remove the pillow from under this knee. So I'm just going to slide my client's leg up, and I'm going to fold the pillow out from under there. Slide your leg down for me, please. And just lift the opposite leg for me, please. And I'm just going to pull that pillow out and back down. Okay, so that if we're working and testing this leg, the opposite knee is still well supported for the client. So the first thing I'm going to do is an active contraction of the quadriceps. So they extend the knee. So I'm going to bring the knee into a little bit of flexion, and I'm just going to ask my client, can you slowly straighten your leg for me, please? Slide it along the bed. Any pain? When did they feel the pain, and where did they feel the pain? If they felt pain on initiation of that contraction, indication that it could be tendon or muscle, where do they feel that pain? Where they show us gives us clue, again, is it in that tendon area or is it into the muscle? But if they only felt pain at the end of range, then I'm thinking possibly ligamentous or possibly joint capsule issue. The next thing we're going to do is a resisted active contraction. So I'm going to use my opposing hand to hold the bottom of the leg. Now try and straighten your leg for me, please. And they're simply resisting into me. So as he tries to extend that leg, he's meeting the resistance of my hand. And again, do you feel pain? And if so, when do they feel the pain? And most importantly, where? If they didn't feel pain at all, that again is indicative that it's likely to be an issue in the joint itself, whether ligament, joint capsule, something in the knee itself. Okay. The next step is a passive stretch of the muscle itself. So a passive stretch of the quadriceps would be to flex the knee. So I'm going to bring the client's leg into flexion. bring the foot onto the bed, opposing hand keeping the knee and the hip from falling out, so support your client. And I'm then going to slide the foot as close as I can towards the glutes. Okay, so bringing that heel to the bum. Do they feel pain? And if so, when and where do they feel the pain? Now, if my client's reporting that yes, they feel pain at that end of range, also they didn't feel pain on the active resisted, and they felt pain only at the end of range of the active contraction, then I might suspect it's something to do with the joint capsule or ligament, for example. In that case, I would proceed to test many end of ranges to see whether or not that also reproduces the pain. So bringing that leg into extension, again, does that cause pain? If so, where do they feel pain? Again, if they're feeling pain on full extension as well as full flexion of the knee, that's indicative that it could be an issue with the joint capsule itself. Again, remember that the knee actually does have a rotational element, but only when the knee is at 90 degrees. Okay, so only when the knee is flexed. So again, we're going to add a little bit of rotation through that tibia. Any pain, where do they feel the pain? And a little bit of external rotation to that tibia. Again, if they feel pain, where do they feel that pain?